Good afternoon, everyone, and thank you for joining today's online presentation entitled Moving Forward with Healthcare Reform. The ball is back in your court. Starting things off today, we have Chris Calvert.
Thank you, and good afternoon, everybody. I'm Chris Calvert, and I run Simpson's corporate health practice. We're here in New York City. We're really excited to get together with you today and talk about what's happened over the past few weeks. Some would say it's a whole lot of nothing compared to what could have happened in regard to the Affordable Care Act, but there are certainly some changes and a lot of questions around what this means and what it means for you going forward. You probably noticed that we called this presentation Moving Forward, and you saw the allusion to the tennis ball. That's because the ball really is back in your court now. It is time for you as plan sponsors to make some decisions on two fronts. Number one, you need to start getting ready to comply with different regulations and different requirements of the Affordable Care Act. And this is not to imply that you haven't been getting ready, but I think we've seen some inertia waiting for the decision of the Supreme Court, and now that inertia needs to go away pretty quickly. And number two, the other thing that's really in your court now is to strategize and consider opportunities that come out of the Affordable Care Act. The way that health care is delivered in this country is going to change. So with all of the angst of compliance and regulatory issues, there's also opportunities for you to take advantage of this new market, and we'll talk some about that. Joining me today are Kathy Bakich, who runs our health compliance practice, Randy Carter, who is one of our lead communication consultants and works with many employers on communicating benefits and other issues to employees, and Matt Kirsting, who's one of our lead health actuaries and is going to keep us all honest when we start talking numbers today. On the first slide, you'll see what we're going to cover. We're going to talk about the Supreme Court's decision and how they came to that decision and what it means. We'll talk about the legislative and regulatory outlook. While we are not here to comment politically, it is clear that the legislation and regulations and politics of this act are not complete and are still in flux. We'll spend some time on the state exchanges because they are a core component of what comes next with the Affordable Care Act, and we'll talk about the other provisions that are coming up and are in certain instances still in play. Towards the end, we'll talk about a to-do list for you, what you should do. I'm sure you've heard a lot of different opinions, but we'll try and break that down for you. And finally, we'll talk about communicating all this to your employees. As you are, to some extent, wondering what all this means, your employees are doing the same. We're going to start the discussion now, but please know that this is the beginning of the discussion with SIBSN. We will be following up through publications and webinars, and for many of you, directly with your account teams. So I'm going to turn it over to Kathy Bakich to talk about the decision and look forward to our discussion today.
Thank you, Chris, and welcome everybody. As you know, the Supreme Court heard arguments about the ACA in March. Now, the Affordable Care Act was originally passed in March of 2010 as part of two bills. There was a Senate bill and a reconciliation bill. Only a few hours after the law was signed, lawsuits started being filed challenging parts of the act. The focus of those lawsuits was a challenge to the individual mandate and also a challenge to the expansion of Medicaid. Specifically, the lawsuits alleged that the individual mandate, which required individuals to have minimum essential coverage or pay a penalty when they filed their tax returns, was unconstitutional. The lawsuits alleged that the entire statute needed to be declared unconstitutional. However, the Supreme Court appointed special counsel to address whether the entire law had to be thrown out or whether only portions of the law were affected. In addition, the court appointed special counsel to address whether a law called the Anti-Injunction Act prevented the court from deciding whether the penalty was constitutional because no one had yet been assessed a penalty. Finally, the court addressed whether the expansion of Medicaid in the ACA was constitutional. The before we get into what the court decided, I think it's important to look at what they were being asked to do.